Yo guys, welcome to our channel again today. Today we have a very interesting topic. The channel is Nazvin. My name is Vincent. This is where we get to talk matters medical in a simple language which we can always understand. That's why you need to like the video so that YouTube can get to recommend us to a larger population. Kindly, if you have not subscribed, because many of us are watching without subscribing, kindly I want to request you to subscribe, and I give you 2 seconds to do that. Yes, thank you for subscribing, guys. 12 foods you should avoid if you are hypertensive. 12 foods you should avoid if you are hypertensive. That's what we're going to talk about today, guys. So if you have hypertension or if you have high blood pressure, it is important or very important to manage your diet to help you control your blood pressure levels. And I'm going to give you 12 foods which you should avoid or limit at the end of the day. Number 1 is about salt and salty foods. Salt and salty foods. High sodium intake can raise blood pressure, so avoid table salt, especially soy sauce and foods like chips, and also pretzels and also salted nuts. Number 2 food which you should limit or avoid is processed meats, because what we call like deli meats, bacon, sausage and hot dogs, they contain high levels of sodium and preservatives, so they predispose you to high blood pressure. Number 3 is about canned foods, soups and also vegetables. These often they are added with salt for preservation and flavor, so opt for low sodium or non-salted added versions so that you may get to use those soups and also vegetables. Number 4 is about frozen meals. Many frozen dinners are high in sodium, so check labels for low sodium options. If you have to take frozen meals, go for the low sodium options. Number 5 is about pickles and also pickled foods. These are preserved in the salt and making them high in sodium, and this sodium is likely to make your blood pressure go high. So pickles and pickled foods, they are not very conducive for your health. Number 6 is about fast foods. Especially when we talk about burgers, we talk about fries and other fast foods. They are typically high in sodium, also saturated fats and also calories. So very key, avoid those fast foods. Number 7 is about cheese. And when we talk about cheese, we're talking about cheese. They contain high sodium and saturated fats. So choose low sodium varieties or limit your intake. Number 8 is about bread and baked foods, where some breads, rolls, pastries contain added salt and sugar. So you should avoid those bread and baked foods. If you take them with the advice of your dietitian or your nutritionist, who should guide you accordingly to avoid those high sodium levels. Sweets and sugary beverages, we talk about this, because the intake can lead you fast to weight gain, and they can also increase blood pressure. So avoid sugar, avoid soda and candy and desserts which contain especially those sweets and also sugary beverages which can predispose you to this. Also alcohol, excessive drinking of alcohol raises blood pressure. It is best to limit your alcohol intake to moderate levels so that they can get to help you. Red meat is also another challenge, where red meat is high in saturated fat, which can contribute to high blood pressure. So opt for lean meats and also plant-based protein sources to help you adjust accordingly. Number 12 is about caffeinated drinks. Excessive caffeine can raise blood pressure, so temporarily limit the consumption of coffee, energy drinks and certain teas, which can exacerbate the condition of getting to high blood pressure. So guys, by managing your intake and focusing on diet rich in fruits, vegetables, whole grains, lean proteins, and low fat dairy, you can better manage the hypertension. Always consult with the healthcare provider or dietitian for personalized advice according to your need. On managing the hypertension in combination with the lifestyle and also is very key. If necessary, medication also can be introduced at the particular point. In the management of high blood pressure, dietary changes are very key. And when we talk about this, we talk about adopting the DASH dietary approaches to stop the hypertension, dietary approaches to stop hypertension or DASH diet. The emphasizes fruits, vegetables, whole grains, lean proteins, low fatty dairy, and limiting saturated fats, cholesterol, and also sodium. Number 2 is about reducing sodium intake. Aim for less than 2,300 microgram of sodium per day, and ideal close to 1,500 mg, as recommended by the American Heart Association. So eat potassium-rich foods. When we talk about these, things like bananas, oranges, potatoes, spinach, and also beans are good sources for potassium-rich foods. Limit alcohol intake, so because up to 1 drink a day for women and 2 drinks for men. This is a recommended way of taking your alcohol. Avoid sugar and processed foods. This can contribute to weight gain and elevated blood pressure. Physical activity is very key also as a way of managing high blood pressure. Regular exercise is like getting 150 minutes of moderate intensity aerobic or 75 of vigorous exercise each week. Activities like walking, cycling, swimming, jogging are very beneficial. So strength training, including muscle strengthening activity, or having them 2 or more in a week can really help you manage your hypertension. Weight management is very key. Achieve a healthy weight, where even a small weight loss can significantly impact blood pressure. Aim for a balanced diet and also regular physical activity, so that change in your weight, even a bit, can really significantly help you manage your blood pressure very well. Monitor waist circumference, so that's very key. Excess fat around the abdomen can increase the risk of hypertension. Men should have a waist measurement below 40 inches and women below 35 inches. That's very key to help you get to that level. So monitoring and medication is also another way of managing that thing. So regular monitoring is very key, where you get to check your blood pressure at home and keep track of the readings. Consult your healthcare provider for guidance for abnormal and abnormals. Medication adherence, if you are hypertensive, the adherence to medication is one key component which can really help you get to a level which is needed or is friendly to you, so that you may get that help. Consult with your dietitian, especially with a registered dietitian, to provide personalized dietary advice to help manage your blood pressure. So combining these strategies can significantly help and manage or lower your blood pressure, reducing the risk of complications such as heart disease and stroke. So sometimes we have complications related to high blood pressure. So poorly treated or poorly managed hypertension can lead to a variety of serious complications. And some of these complications are cardiovascular complications. Number 1, we have what we call heart attack. High blood pressure can lead to coronary artery disease, which can result in heart attack due to reduced blood flow to the heart. We may have a heart failure at the end of the day, which where the heart becomes enlarged and weakened for constant pressure, leading to heart failure, which the heart can pump blood. The heart cannot pump blood effectively. Aneurysm is also another thing, where increased blood pressure can cause blood vessels to weaken and bulge, potentially leading to a life-threatening aneurysm, often in the biggest artery, which we call aorta. Kidney damage is also another complication, where we have chronic kidney disease coming up. It's because hypertension can damage the arteries around the kidneys, reducing the ability to function properly, and also relating to chronic kidney disease or kidney failure at the end of the day. Eye damage is also another one, where we have what you call a retinopathy. High blood pressure can damage the blood vessels in the retina, leading to retinopathy, which can cause vision loss. Also, we may have what we call optic neuropathy. It can lead to nerve damage in the eyes, resulting in vision impairment. Metabolic and other complications, where metabolic syndrome is one of the things. The cluster of conditions include high blood pressure, high blood sugar, excess body fat around the waist, abnormal cholesterol levels, increased risk of heart disease, and also stroke and also diabetes. Number 2 is about cognitive impairment and dementia, where hypertension can affect the blood flow to the brain, leading to cognitive decline, memory loss, increased risk of dementia at the end of the day. Peripheral artery disease, high blood pressure can cause narrowing of the arteries in the legs, arms, stomach, and head, leading to peripheral artery disease, which can cause pain and also mobility issues. Sexual dysfunction is also another thing where erectile dysfunction can come in. In men, high blood pressure can lead to erectile dysfunction due to reduced blood flow. Sexual dysfunction in women is also another thing where women may experience reduced libido or arousal issues due to hypertension. So bone health is also another thing where osteoporosis comes in. High blood pressure can cause increased calcium loss through urine, potentially leading to weakened bone and osteoporosis. In pregnancy, preeclampsia is a complication where blood pressure during pregnancy can cause preeclampsia, a serious condition which can affect both the mother and the baby. So proper management of hypertension through lifestyle changes, regular monitoring, medication adherence can significantly reduce the risk of complications. So regular checkups with the healthcare provider are essential for early detection, effective management of high blood pressure at the end of the day. How do you prevent these complications? Reduce your sodium intake through your healthy diet. Eat potassium-rich foods. Potassium helps balance the sodium levels. So food like the banana, oranges, potatoes, spinach, and beans are excellent sources for the potassium, which helps to manage the blood pressure. Follow the DASH diet. The dietary approaches to stop hypertension is very key, where we emphasize on fruits intake, vegetables, whole grains, lean proteins, low fatty dairy, limiting saturated fats and bad cholesterol with refined sugars. Also very important is about regular physical activity, where we exercise regularly, 150 minutes of moderate intense aerobic exercises, 75 minutes of vigorous exercise each week. Activities like cycling, walking, swimming, jogging are very beneficial, including strength training. This incorporates the muscle strengthening activities at least 2 days a week. Maintain healthy weight. Weight management is very key. Aim for healthy body weight. Even a small amount of weight loss can significantly reduce the blood pressure. So you monitor your waist circumference is also very key. Limiting alcohol consumption is another one, where you should drink moderately as appropriate. Avoid tobacco. Quit smoking. That's very key, because these are likely to damage your vessels and also increase the blood pressure. Reduce stress. Manage your stress. Yes. Managing stress is a very important aspect where one gets to manage this hypertension through the yoga, meditation. Sorry guys. Thank you for that. And sorry for that. So ensure adequate sleep. 7 to 9 hours of quality sleep each night is very key. Limit caffeine intake is another way. Regular monitoring of your blood pressure is very key. Healthy lifestyle choices like taking a balanced diet includes a variety of nutrients. Drink plenty of water throughout the day. Avoid excessive sugar and also processed foods. Limit the intake of sugar beverages as highly processed foods. Professional guidance is also another way, where you consult your healthcare providers regarding your health for checkups and also advice on maintaining health blood pressure. Guys, consider dietitian also. The dietitian can provide personal dietary recommendations. So by this integrating the preventive measures and also your routine, you can significantly reduce the risk of developing the hypertension. So for weight management, limiting alcohol intake, avoiding tobacco, reducing stress, getting adequate sleep, monitoring the caffeine intake, regular medical checkup is also very key. Considering a dietitian advice is very key to really adjust and also manage your blood pressure. Guys, that's about managing hypertension, and I started with the 12 foods which are very important to manage hypertension. So by integrating these habits of diet, exercise, lifestyle modification, you get to significantly lower the risk of developing hypertension and maintaining the blood pressure levels at appropriate position. And if you are hypertensive, I've said about the foods which you should avoid or limit to the level which is needed. Guys, welcome. The channel is Nazvin, and if you are not subscribed, I want to request you to subscribe so that matters as hypertension can really be brought to you in a simple language as this. Guys, welcome and peace, guys. We love you.